You're listening to Peterborough's community radio, Salam Radio. Salam Radio. 106.2 FM.
Assalamu alaikum. This is your very own Dr. Shabina Asad Qayyum for Salam Radio 106.2 FM. I'm delighted to be back. You know, the last time I did this show, it seems like a distant memory, or either that or the time has just gone by and flown by very slow, hasn't it? Nevertheless, it's wonderful to be back with you, my wonderful listeners, brothers and sisters, friends, anybody that's out there that's listening to Salam Radio. This is the Body, Health and Mind Show on Salam Radio 106.2 FM. And I am your host, Dr. Shabina Asad Qayyum. I am a GP local to Peterborough, work at a practice in the centre of Peterborough, and I'm also the radio host for our weekly show on Salam Radio, which broadcasts so many wonderful shows. I mean, prior to my show, we had the show with Brother Rustam Suleiman, and what a wonderful show that was, where he actually performed live naats, which was very good, and the two guests that were attending with him as well. And I can see a lot of praise for that show. And I'm so pleased to be part of the Salam Radio family. So indeed, it is wonderful to be back to all of you. I hope that you've all been keeping well, and I hope that you've all been keeping out of the cold and being healthy with protecting yourself from all those horrible bugs. And actually, I am going to take the opportunity to stress to you and say to you that flu season is approaching. Please make sure that you're having your flu vaccination to protect you, especially if you've got any underlying medical issues. And other than that, I thought that I would talk a little bit about what health themes actually go on. Have you ever noticed throughout the year there are particular months that have a particular medical theme, whether it's fundraising? You have Macmillan in September. In October, you have Stoptober, which is all about smoking cessation. And in November, you have issues about the prostate. But before I tell you what my show content is actually going to be about, I am going to say that I would love you to participate. Come and call me. It'd be wonderful to speak to you on 01733 602 133. You can text me on WhatsApp number, which is 07411 191062. And indeed, you can comment on the live stream on Facebook, YouTube, X, which is the previous Twitter, or Twitch. It would be wonderful to hear from you. Now, listeners, without further ado, I am going to talk to you a little bit about what my show is going to be this afternoon, or evening, should I say. I think the clocks that have gone back, it's become dark quickly, so I still think we're in the afternoon phase according to the old timings. Will I be forgiven for that? I guess I will. So I wanted to talk a little bit about prostate health, and you'll be wondering why. And I'm going to draw your attention back to the beginning of the show when I said that throughout the year, certain months have certain health themes. And indeed, November marks something known as Movember. And why is it called Movember? Because it is the health awareness month for men's prostate problems. And I think that it's really important that we focus on prostate problems. I talk a lot about women's health. I talk a lot about mental health. And I actually did ask myself this question: why aren't I doing any more or much more in the way of men's health programs? I think that's really important. And we shouldn't shy away from men's health issues. I must say, as a GP, it's actually not an area of expertise of mine. And it's always important to admit that you do have areas where you could learn a little bit more. And I've always felt that lower urinary tract problems or prostate problems are something that I'd probably like to know a little bit more about. But from a GP perspective, I most certainly am well versed with how to deal with lower urinary tract symptoms and prostate problems as well. And that's why a generic show on what to look out for in the way of prostate issues, what urinary symptoms have to be investigated in men, I think should be talked about. And that's why I'm here today. So I do want to talk to you about prostate issues. I think it'd be important for us to talk a little bit about an enlarged prostate and prostate cancer, because every patient that comes to me with an issue, the majority of them won't be thinking about cancer, but there are just certain things about, or certain symptoms that patients present to you about, that who will have cancer as a concern at the back of their head, and justifiably so. So it's my job as a clinician, and my colleagues as well who see such patients, to investigate and look into their issues. So let's talk a little bit about prostate cancer in the tail end half of the show. I think that would be a really good idea. But before we go into the specifics, let's talk about what the prostate is and why it's important to men's health. So first of all, it's a small walnut-sized gland that sits below the bladder and around the urethra, which is the small outlet from which urine is secreted. And although small, this gland is very small, it's only the size of a walnut. This gland actually plays a very significant role in male reproductive health, as it produces some of the fluid that is in semen as well. So I think it's important that we speak about these things in an open and honest manner, and to mitigate some of the taboo that's around men's health problems as well. And what I will try and do in future programs is I always try to get on board a specialist in the area. So hopefully with developments in the show, I will be getting specialists in their field who are experts in their field, and perhaps we can talk a little bit about specific questions that you may have as well. And what I'm going to talk about is what the prostate does and why men have issues with their prostate, especially as they age. Now, the prostate, as I said before, produces fluid that nourishes and protects sperm. And this fluid is squeezed into the urethra when a male ejaculates, and it's expelled with the sperm. But as men age, the prostate can become enlarged or develop other issues due to hormonal changes. And this is very common, and it's often part of the aging process. And I'm going to give the analogy with women. So women produce the female hormone, which is called estrogen, that is responsible for them to menstruate on a monthly basis. And as women approach their 50 to 55 years, they go through a process known as menopause. It is a natural part of the aging process where the estrogen level falls within women, and as a result, she no longer produces eggs. And she can't get pregnant after menopause. So when the ovary stops making eggs, it's usually because of a lack of estrogen. And also there are other hormones involved too. And that is when her reproductive cycle or process or age stops, or it comes to a halt. Now, in the same way, men are able to, as compared to women, procreate and reproduce for the whole of their lifespan. However, everything has an aging process in our body, and the prostate is a gland that is one of them. So with age, men's prostates enlarge, which then can lead to other symptoms as well. And I know that it sounds uncomfortable with the prostate enlarging, but it's when it starts to become a problem for men. And typically, men start to experience issues with their prostate from the age of 50 onwards, although symptoms can sometimes occur earlier. For example, something known as benign prostatic hyperplasia, which is an enlarged prostate, is common in older men, and it can cause issues like difficulty with urination. And I have Jason McNally, who has joined the show. Good evening, Doc. Good evening, Jason. It's wonderful to have you on the show. Thank you very much for listening in. It's always a joy to have people listening to the show and engaging as ever. It's very kind of you. And if you've got any questions, just don't hesitate to ask. So I'm going to remind you all, call us on 01733 602 133 if you want to talk to me about prostate problems, or you can text us on 07411 191062 and comment just like Jason has on the Facebook, YouTube, X or Twitch feed. I'd love to hear from you. I'd love to hear some questions. In fact, just before the show, I had a viewer who had asked me a question about fatty liver. I will endeavour to answer that question during the course of the show. So even if it's not related to the show content, I'd be happy to give you an answer in whatever capacity I can. But do be wary of a disclaimer that I always announce in all shows, and that is that if you have any problems, all the advice that we give here on Salam Radio is generic advice, but always try to consult with your own GP. So I hope that makes that clear. Now, the common prostate problems are three main problems. So we have benign prostatic hyperplasia. Now, benign prostatic hyperplasia, very much as the name says, is an enlargement of the prostate. And the prostate gland, like I said before, commonly becomes larger in older men. Women do not have a prostate gland, just like men don't have ovaries. And the prostate gland enlargement, the process itself is called hypertrophy or hyperplasia. It can cause problems with passing urine. The symptoms often start off very mild, but without treatments, symptoms don't always become worse and may even improve over time. But if those symptoms become troublesome or distressing, they can be improved by medicines and, in extreme cases, surgery as well. Now, in enlarged prostate symptoms, the symptoms are called lower urinary tract symptoms. Now, lower urinary tract symptoms can be caused by other conditions. As the prostate enlarges, it causes narrowing of the outlet tube through which urine passes in men, and this may partially obstruct the flow of urine because it just sits at the entrance to the urethra, which is the tube through which urine passes. So you can imagine, if the prostate, which was originally a walnut size or should be a walnut size, starts to grow, it then blocks the flow of urine into the urethra, which is why people can have a problem with the outflow of urine. Now, what are the symptoms for benign prostatic hyperplasia? You have poor stream, which means that your flow of your urine is weaker and it takes longer then to empty your bladder. Then you have something called hesitancy. Now, hesitancy means that you may have to wait at the toilet for a while before your urine starts to flow, but you have the urge to want to go. Then you have something called dribbling. So towards the tail end of passing urine, the flow becomes a very slow dribble. And often that can feel quite uncomfortable, as if you haven't quite emptied your bladder, and that can be a horrible sensation too. And poor emptying. You may have a feeling of not quite being able to empty your bladder. Now, the enlarged prostate may also make the bladder irritable, which may cause frequency. So if you have frequency, people who've got an enlarged prostate, men will get up more so during the night, more often than normal. And this can be very irritating at night time, and it's a symptom that's called nocturia. Okay? And getting up at several times a night to pass urine is a very common symptom of people that have an enlarged prostate or benign prostatic hyperplasia. Then there's another symptom that's called urgency. And this means that you have to go to the toilet very quickly if you have or feel the sensation that you want to pass urine. You may be in a shopping market, or you may be out and about doing whatever you want to do, doing your task for the day. Or you might be at work, and all of a sudden, when you have the urge to want to go to urine, urgency is that you need to go and find a toilet quick. Otherwise, there is the risk in some cases that you soil your clothing and you become incontinent, or you pass urine. So that's a phenomenon known as urgency. Now, with benign prostatic hyperplasia, as was said at the beginning of the show, the symptoms are mild to begin with, and perhaps they have a slightly reduced urine flow, or having to wait a few seconds to start to pass urine. But over months or years, the symptoms may get worse depending upon the growth of the prostate as well. And in some very, very rare cases, severe complications may arise too. Now, when we look at statistics, only a quarter to a half of men with an enlarged prostate will go on to develop symptoms. And the severity of the symptoms are not always related to the size of the prostate. So it really does depend upon which part of the prostate is enlarged and which part of the prostate actually obstructs the urethra, which is the outflow of urine. So that's something really to think about here. Now, not all urinary symptoms in men, like I said before, are due to an enlarged prostate. In particular, if you pass blood, or if you become incontinent, in other words, lose urine without knowing, or if you have pain on passing urine, it may be due to a bladder, kidney, or other prostate conditions. And you should see a doctor if these symptoms do occur. So we've given you what the symptoms are of a benign prostate enlargement. But if you get blood in urine, you find that you're incontinent at all, or you have pain when you're passing urine, you shouldn't just put that down to the fact that your prostate's enlarged. You should see a health professional. And those are your three things that I would really like you to focus on as well. If you have back pain, or if you're losing weight unintentionally, please don't just assume that you've got an enlarged prostate. Please go and see a GP. And if you have existing prostate symptoms and you develop these symptoms on top of that, then still go and see a GP. It's very important. Now, what are the causes? Everybody wants to know what's the cause of this illness or this condition. Why wouldn't you want to know the cause? It's very important that you'd want to know the cause. Now, through research and through our knowledge of the natural condition process and the disease process, it's been put down to the fact that the prostate will normally enlarge as a part of the aging process as men get older. Therefore, that is why we see a number of men in the latter part of their age have an enlarged prostate. But it's also thought that changes in the male sex hormones that occur with aging may be at least part of this natural aging process. But an increase or enlargement of the prostate can also be caused by prostate cancer or inflammation of the prostate due to infection called prostatitis. And prostatitis can present as acute prostatitis and chronic prostatitis. So acute prostatitis is a sudden onset of infection and inflammation, whereas chronic is more slow, it's more long in terms of process, and that is what then gives us chronic prostatitis. Now, serious complications, if you've just got benign prostatic hyperplasia on their own, are very, very rare, okay? And they're unlikely to occur in most men with an enlarged prostate. But it's important to talk about the complications too. So in some cases, a total blockage of urine occurs, so you won't be able to pass urine, and that's something that is called urinary retention, in which the bladder has this urine, and obviously if there's no way for the urine to be expelled from the bladder can become very uncomfortable, and patients can find themselves in a lot of pain. And trust me, I have seen people who have obstruction as a result of benign prostatic hyperplasia, and it is horrible to see. It's a horrible thing to have. So in such circumstances, those patients who have a complete obstruction to the outflow of urine are often catheterized. Now, catheter is the insertion of a small tube into the urethra that then communicates with the bladder, and urine slowly comes out into a bag. Okay? And that's happened before, where I have seen patients, and I've even had to catheterize them as well. I've done many catheters, especially when I was in Scotland, because we had to do an out-of-hours stint when I was in Scotland in the out-of-hours area. And sometimes you go to very remote places. So I've had to catheterize people who have been in urinary obstruction. So I've definitely seen that too. Now, the other complication is that in some cases, some of the urine in the bladder is emptied when you pass urine, and some urine remains in the bladder at all times. This is called chronic retention. And what does chronic mean again? Chronic means that the urine, chronic means a longer process. Acute means sudden onset. Chronic means over a period of time, a more slower process. And this is called chronic retention. This may cause repeated urine infections or even incontinence, which is completely losing urine without not knowing. And urine dribbles around the blockage rather than large amounts being passed each time an individual goes to the toilet. Now, one of the things I think is really important to state here is that if anybody has got an enlarged prostate, that doesn't increase their risk of having prostate cancer. That's really important. That's something that I really want to hone in, that just because you've got an enlarged prostate doesn't mean that you are at increased risk of developing prostate cancer. There are men with benign prostate enlargement that are no more or no less likely to develop prostate cancer than those without benign prostatic enlargement as well. So how is it enlarged? So it's usually enlarged on the basis of the symptoms that people give us when they present, with dribbling, with getting up more frequently at night, with going to the toilet more often, with having hesitation of urine and urgency too. And as a result of that, GPs will then speak to their patients and do something which is known as an international prostate scoring symptom. And when that is done, depending upon how severe the symptoms are, they can often either be given a medication or sent to the attention of a specialist. And initially, if you have these symptoms, a doctor may want to examine you as well, just to see how big it is. And this is done by a manual examination in the back passage. It is very important that I communicate this to you, because often within the Muslim community and within our communities, these are very sensitive topics to discuss. And the purpose of having this show is to mitigate that hesitation and taboo and stigma associated with such sensitive medical topics that people won't be open in talking about. But it's equally as important that I give you the information about the process of examination so that you're mentally prepared. So the prostate is examined through a back passage examination. And so your doctor will, through an examination through the digits, known as a digital rectal examination with the use of a gloved finger, will examine your prostate if you are having symptoms of benign prostatic hyperplasia. So I'd really like you to hold on to that thought and think about that as well, and not feel shy or not feel hesitant about it. There is no need to do so, because your GPs do not judge you as man or woman. They judge you as a patient only, and that's what GPs are trained for as well. In addition to that, urine and blood tests are also done to check the function of your kidneys, to exclude an infection, that's one of the other things, and also to check that there's no blood in your urine too. Sometimes a referral to a urologist who is a bladder specialist may be advised if your symptoms are troublesome or complications develop, and they may look into the bladder by means of a camera test as well. So that then tells them if there's anything at all that's causing the outflow obstruction of urine, or how bad the benign prostatic hyperplasia is. Now, we're approaching a break. After the break, we're going to finish off the topic of benign prostatic hyperplasia, and we will go on to speak about prostate cancer. I hope you've been enjoying the show. It's been good to see the level of engagement as well. We will be talking a little bit about how we use medication to treat benign prostatic hyperplasia and the signs and symptoms of prostate cancer. So keep tuned. Don't go away. I'll be waiting for you. Just a little break.
This is Salam Radio, Peterborough's Muslim community radio. Broadcasting on 106.2 FM and online.
At Cake Inn, all our cakes and slices are freshly baked for that delicious taste. At Cake Inn, we bake 100% vegetarian and halal eggless fresh cream cakes. Delicious flavoured cakes for birthdays and weddings, ceremonies and all other occasions, with free customised messages, even balloons and candles too. Order for delivery or collection from Cake Inn, 489 Lincoln Road, PE1 2PE, and your cake could be ready within 2 hours. Find out more and order online at cakeinn.co.uk or call 01733 496 584.
Attention foodies! Discover a world of flavours at Pack Foods, the largest ethnic supermarket in Peterborough. Shop our vast selection of authentic ingredients from around the globe, including spices, marinated fish and meats, and exotic fruits at incredibly low prices. And the best part? We offer free parking. No more hunting for a spot. Come visit us today and explore the incredible range of flavours at Pack Foods, 232 Lincoln Road.
Satisfy your cravings at Ibrahimi Buffet Restaurant. Enjoy a tantalising variety of Chinese, Italian, Pakistani and comfort food favourites, from starters to desserts. Kids under 5 dine for free, so bring the whole family to our restaurant at 63 Sycamore Avenue. Open every day from 5pm to 10:30pm. Call us on 01733 313131 or book online to reserve your table. Ibrahimi-restaurant.co.uk. Every bite is a delight at Ibrahimi Buffet Restaurant.
Do you own a restaurant or takeaway? Cater Fair is an expert supplier of new and used commercial catering equipment. Visit caterfair.co.uk for quality equipment on sale at the lowest prices, or call us on 01733 310 115 or visit us at 11 Royce Road, Fengate, Peterborough.
Craving authentic Desi flavors? Look no further than Desi Restaurant. From midday until 1 in the morning, enjoy our homemade specialties that will transport your taste buds. Indulge in tantalizing papri chaat and savor the rich Chersi Kadahi. Treat your friends to our fresh 1 kilogram Chersi lamb handi. Plus, get 2 12-inch pizzas for $11.95. Located at 298 Lincoln Road, we deliver from lunchtime until 1 a.m. Call 01733 555 795 now to order and experience Desi Restaurant's flavors.
Masterminds Tuition Academy is for your high schoolers, your something to provers, your subject strugglers and keen learners, your brave jumpers and fist pumpers. Affordable personalised learning plans are delivered through our centres in schools across Peterborough. But not to worry, we also provide online and home visits with flexible timings. Whether it is maths, English, science or 11+, Masterminds is a must. Find us on all socials and visit our website, mastermindstuitionacademy.com, or call us on 07516 166 003. Masterminds, master the matrix.
Whether you visit the Berry Furniture Showroom at 78B Fengate in Peterborough or view and buy online, you'll be amazed at the quality and style you could enjoy in your home. With beds from just £299 and complete 3-2-1 sofa sets from less than £1,000, you'll also be amazed at their wholesale prices too. Plus, there's a 1-year free warranty on sofas and beds, subject to conditions. Find out more, click on Berry, that's BERRE furniture.co.uk, or call 01733 300 517.
You're listening to Peterborough's community radio, Salam Radio. Salam Radio. 106.2 FM.
Assalamu alaikum and welcome back. It's wonderful to be back in the second half of the show, and I'm very conscious that the last half of the show really does race by, doesn't it? Well, we're talking about prostate problems, and it would be wonderful if you could join us in the show and participate. I know that there are many that are watching very actively and exclusively, which is wonderful. I'm your host, Dr. Shabina Asad Qayyum of Salam Radio 106.2 FM, and it would be good for you to give your views. What are your views? Do you suffer from prostate problems? Do you have any particular questions that you'd like to ask me at all? If you do, you can call me on 01733 602133, or you can text and WhatsApp us on 07411 191062, and you can comment on the live stream on Facebook, YouTube, X or Twitch. Now, before the break, I did talk about the treatment of benign prostatic hyperplasia and how we go about diagnosing it. But it's important also to talk about the medicines. What would we give to somebody who's got an established benign prostatic hyperplasia, is unable to pass urine very effectively? What do you do? So the decision to treat with medicines usually depends upon how much bother the symptoms are causing you. There are two groups of medicines that can help now. For simple knowledge purposes, I'm not going to go into these long and lengthy names, but all you've got to know is that one are called alpha blockers and the others, a bit of a long name, but called 5-alpha reductase inhibitors. And medicines actually don't cure the problem, nor do they make symptoms go away completely. However, the symptoms often ease and give you a bit of relief if you do take a medication. So do remember, all the way back to the beginning of the show, I said enlargement of the prostate was a part of the natural aging process. And that is exactly what we've got to tackle. And when you have something that is part of the natural aging process, it has effects. And if it does have effects, then we've got to give you a medication that can address those effects as well. Now, surgery is also an option. So with surgery, removal of a part of the prostate is an option if symptoms are very bothersome or medicines don't help at all. And there are those proportion of people that do really have bad symptoms. They've tried medication, nothing's really working for them, and their quality of life is just absolutely miserable because they've been unable to address those problems. So what do we do for them? Surgery. So a specialist will see those patients and undergo surgery by taking out a bit of the prostate, if not all of it, if it's really that bad. But in these operations, only a central part of the prostate is removed, which creates actually a very wide tunnel for urine to flow through, which leaves the outer part behind. Now, in prostate cancer surgery, if the surgery is carried out for a cure, all the prostate is removed. Okay, that's the difference between benign prostatic hyperplasia and prostate cancer. There are many different types of surgical treatment now available that can remove prostate tissue, including something known as a TURP, which is transurethral resection of the prostate, which means that the prostate is removed through the outlet of the urethra, and transurethral incision of the prostate, which is known as TUIP. Now, you can also have something known as an open prostatectomy, which is a surgical cut is made in the lower part of the pelvis, or a laser prostatectomy, which is quite new. I don't know much about it, but there is information about it on the internet that's available. And the surgeon that you have will discuss these issues as well. Now, there are lots of other innovative treatments for benign prostatic hyperplasia. And like I said, treatment isn't always necessary because an enlarged prostate does not do any damage or cause complications. It doesn't increase your risk of prostate cancer. But whether treatment is needed usually depends upon how bothersome your quality of life has become and how much damage the symptoms actually cause. For example, you might be glad for some treatment if you're woken 6 times at night time to go to the toilet as well. But slight hesitancy when you go to the toilet and getting up once a night to pass urine might not be that bothersome with some people and might be alleviated with a small dose of medication. So I hope that that's helped. Now, we're coming on to the main topic, which is actually about prostate cancer. And I really did want to talk about that because a lot of people that come and speak to me about having benign prostatic hyperplasia or actually an enlarged prostate are always worried about the C word. They always say to me that I don't have cancer, do I? People get very worried about it. So I hope that this show has alleviated some of those concerns because they're valid concerns. As patients, you don't often know what's happening to your body. And it's when your body isn't in control of how you want it to be, then things seem alien, and that's when the fear sets in. So it's our job as clinicians actually to allay some of those fears. So I hope that some of the information that I've given to you about benign prostatic hyperplasia has alleviated some of those concerns. And do ask me any questions. I think some questions have filtered through. I do want to talk about prostate cancer before we address your questions in the latter part of the show as well. But prostate cancer, again, is a cancer that develops from cancerous cells that have developed in the prostate glands. And what are cancerous cells? They're abnormal cells. Usually, every cell undergoes a process of aging and then dying. But what happens to cancer cells is that they mutate and they become abnormal cells. And actually, when they become abnormal cells, they multiply and they form masses, abnormal masses in the organs that they affect, which can then manifest as cancer as well. It's actually the most common cancer in men in the UK, and that's why November is important. Do you remember me talking about the relevance of months and medical conditions? Well, November marks Movember, when many men actually either will shave their beard or not shave, actually. They won't shave their beard. Sorry, I got that completely wrong. They won't shave their beard. They won't shave off their moustache to raise money for cancer, prostate cancer charities. And this is why this month is called Movember. And that is one of the reasons why I wanted to talk about prostate cancer in particular as well. It is the most common cancer in men in the UK, with most cases developing in men over the age of 75, which is a very late stage in life. But still, cancer's horrible, isn't it? So why should anybody get it? But it's important that I give you that statistic as well. What are the symptoms of prostate cancer? Poor stream, dribbling, and an urgency to urinate. And the treatment surrounding prostate cancer can be quite complex, you see. And that's why it's important to talk about it separately as well. And it's important to talk about what causes it too. And that's what I'm going to go through. So if you have tuned in, call me, talk to me about your experiences with a loved one who may have prostate cancer on 01733 602 133. You can text me on WhatsApp, which is 07411 191062. And you can also comment on the live stream on Facebook, YouTube, X or Twitch. I am your host, Dr. Shabina Asad Qayyum, for the Body Health and Mind Show on Salam Radio 106.2 FM. Now, in prostate cancer, around 52,000 men every single year are diagnosed with prostate cancer in the UK. If I put it more into perspective, 1 in every 8 men is diagnosed in the UK at some point in their life with prostate cancer. In most cases, develop over the age of 75 years old. So I hope that's given you some perspective as to how staggering the statistic is for prostate cancer. Now, it's slow growing. It doesn't really reduce life expectancy, but there are varying types of prostate cancer as well. And so there are some that might not need treatment, depending upon the type of prostate cancer that you have. But in some other cases, it can be very aggressive and it can spread to other parts of the body as well. And in those cases, those prostate cancer cases may benefit from treatment as well. The more a cancer has grown and spread to other parts of the body, the less chance that patient has of having a cure. So it's very important. But treatment, and nowadays the innovation in medical science that we have, can often stop the progress of cancer, or slow the progress of cancer. That's a better word. It slows the progress down of that cancer developing. Now, prostate cancer in itself is different to other cancer because the small areas of cancer within the prostate are actually very common, especially in older men. These might not grow so much or cause any problems for many years, if at all. So, what are the causes of it? Aging. Family history can also be a cause, and genetic factor as well. So if your father or brother had prostate cancer at an early age, before the age of 60 years, then you can have an increased risk. But also, if the type of breast cancer which is linked to a faulty gene runs in your female relatives, then as a male, you also may be at risk of prostate cancer. So if you have a female within your family who has breast cancer, which is gene positive, then you might be at risk of prostate cancer. I hope that has registered with you as well, because that's not a very common known fact, is it? Now, ethnic groups, it's more common in Afro-Caribbean men and less common in Asian men. So it's very important that we establish that. Obesity, my goodness, I can never stress enough, obesity is a risk factor for all kinds of cancer. So we must never underestimate the risk factors and health problems associated with obesity. Diet, they say possibly could be a risk factor, but with other cancers, a diet high in fat and low in fruit and vegetables could increase your risk too. With prostate cancer, exposure to the metal called cadmium may be a risk. So if you're involved in an occupation that exposes you to the metal called cadmium, you may be at risk of developing prostate cancer, but that's over a long period of time. Now, what are the symptoms of prostate cancer? Having a poor stream. So if your stream of urine is more weaker than before and it takes longer to empty your bladder, that could be a sign of prostate cancer. Hesitancy, having to wait, not being able to wait to go to the toilet when you get the urge to want to pass urine. Dribbling, again, a bit more urine may trickle out and stain your underwear soon after you finish the toilet. Having urinary incontinence. Frequency, passing urine more times than normal. And urgency, having to go to the toilet quickly. And poor emptying as well, feeling as if you haven't been able to empty your bladder. All of these symptoms are more common in people or of men who are of an older age. Most men develop the above symptoms, don't have prostate cancer, but have an enlargement of the prostate. But if you are somebody that has developed new onset symptoms and you have a first degree relative who had prostate cancer under the age of 60, go and get yourself checked out by your GP. I cannot underestimate the need for you to do that as well. Now, other symptoms could be pain at the base of the genitals, could also be a sign of prostate cancer, especially if you've had a first degree relative too. And passing blood occasionally. But passing blood occasionally doesn't really happen with prostate enlargement. That's the difference between prostate cancer and prostate enlargement too. Now, how do we diagnose it? So with the initial assessment, we have to examine the prostate. And as I said in the earlier part of the show, examining the prostate is through a examination using the digits, known as a digital rectal examination, where your GP will wear a glove and examine your prostate through the back passage entrance. It's important that you know this so that you are mentally prepared for it in the event that you do want to see your GP for any urinary symptoms that you may be experiencing. Now, an enlarged feeling prostate, if you've got enlarged benign prostatic hyperplasia, is quite smooth. You don't feel any abnormal masses on it. But with prostate cancer, a normal feeling prostate gland doesn't rule out that you don't have prostate cancer. You could have a deep-seated nodule that is abnormal within the body of the prostate, and that won't be felt on the surface. And it can be quite tricky feeling the prostate through the back passage because there is no other way of visualizing the prostate unless you send somebody for an ultrasound scan through the rectum, which routinely are not performed in the NHS. I know locally they don't perform them through the GP, and it very much is through a specialist initiation as well. Now, there's also a hormonal blood test known as the prostate-specific antigen, or PSA. And if you are displaying any new symptoms that you're not comfortable with or making you feel poorly in any way, then it's good to have a PSA. Now, the higher the level of PSA, the more likely you are to have cancer of the prostate. But the PSA is quite a funny hormone because it becomes raised in other infections and inflammatory processes as well. So it can be raised in prostatitis. It can be raised when a husband and wife have relations with each other. And that is how the prostate PSA hormone is raised as well. So it's not just for cancer. And that is why whenever we order a PSA test for someone, we give them precautions beforehand. We make sure that they're not suffering from any prostate infections. We ask them to abstain from marital relations with their wife or spouse a week before having the test as well. So it's very important. Also, a week after having a digital rectal examination, because often when you manipulate the prostate through a digital rectal examination, it can give you a false positive PSA or a slightly temporarily raised PSA, which could be a false alarm. So it's important that we perform the PSA at the right time as well. Now, MRI scans, if you find that the PSA is high within the GP setting, we often send those patients to a specialist to see. And it's often the specialist that will then undertake an MRI scan, which will detect or not the presence of prostate cancer. It's known as a multi-parametric MRI, and it's a relatively new scanning procedure that produces a very detailed image of the prostate. It has been approved by the National Institute of Clinical Excellence, or in other words, NICE, and it prevents unnecessary biopsies for those with a low-risk cancer. And we're quite optimistic, actually, that the system will make it easier to identify cancers earlier and reduce the need for having further treatment. Now, if something is identified in the prostate, then usually a small biopsy of the prostate gland is undertaken with a fine needle. And this is usually done with a special ultrasound scan as well. Several samples are usually taken from the prostate and sent off to the lab. But if you are somebody that is awaiting a prostate biopsy, don't worry, because it can be uncomfortable and a local anaesthetic is often used to reduce the pain as much as possible as well. Now, prostate cancer in some cases, very rarely, can be diagnosed from analysing the prostate tissue removed at the time of something known as a prostatectomy operation, which is removing the whole of the prostate. 2. Then you have grading of prostate cancer. And I'm not going to go into that simply because of the fact that prostate cancer and staging, it will be alien to you at this stage. And I honestly feel by giving you too much information can sometimes make you confused. I think for my viewers' purposes, it's very important that I give you the main symptoms of prostate cancer, how you go to your GP, what examination you should expect, what tests you should expect, and thereafter, if you are diagnosed with cancer, what then you can have in the way of treatment, okay? And I've already told you about one element of the treatment, which is taking out the whole of the prostate gland. Your staging process is better versed, explained to you by a consultant. And that's why I'm not going to actually, for the purposes of this show and also for time and efficiency, not explain to you what staging means as well. So I've got Lee Taylor, who has come on the line. Evening, sorry I'm late. That's okay, Lee. It's wonderful to have you. Welcome. I hope that you can gain some insight on prostate issues that I'm talking about right now. Now, what are the treatment issues? If you have a patient now who's been diagnosed with prostate cancer, there are a couple of treatment issues. So surgery, radiotherapy, and hormone treatment as well. Hormone treatment usually with an injection that's known as Zoladex, which is effective. It helps shrink the tumour, and less commonly chemotherapy. Chemotherapy is only used in very rare situations, but sometimes a combination of chemo and radiotherapy is also very effective too. So it depends upon what setting you're in and also what type of cancer of the prostate you have. If it's something more aggressive, then your treatment will be a little bit more stronger as well. But that really does depend upon your type of prostate cancer. Now, sometimes, in very rare occasions and very sadly, if cancer is advanced, then pain relief is very important because the cancer, the prostate, sits also just in front of the back area as well and the backbone. And it can give back pain too. Nutritional supplements are also important too, just to make sure that you're not becoming deficient, because your appetite can go away if you're diagnosed with cancer. So it's very important that you look after your health, especially in the way of diet as well. Treatment is to aim to cure prostate cancer in particular, especially in the early stage of the cancer. And if this cancer is caught in the early stages and it is within the body of the prostate, then it can be treated much more sooner as well. And we tend to use the word remission rather than cure. Remission means that it's regressed, we've got rid of it, and you've come out of a journey and a pathway, rather than cure. Now, remission actually also means that there's no evidence of cancer following treatment too. So if you're in remission, you may be cured. However, sometimes on very rare occasions, the cancer can return. So I have a question by Mr. Javed Akhtar. Hello, Mr. Javed Akhtar. What are the treatments available for an enlarged prostate? So if you go back to the first half of my show, Mr. Akhtar, and I'm very, very happy that you've joined, you will see that there are treatments. Now, what I am going to say is that those treatments can be medicinal, but an enlarged prostate is a normal part of the aging process. But if your quality of life is impaired, there are tablets that can be used as well. Diet change, there's no evidence to substantiate that diet change will help. But yes, there's something known as alpha blockers and alpha-1 reductase inhibitors that help with symptoms. So that's in the first half of my show. If you're able to play that back and listen to it, you'll be able to hear all of that in great detail, because that was the first half of my show. But I'm very glad that you've joined, and welcome. It's lovely to have you here as well. So coming back to prostate cancer, surgery to remove the prostate and radiotherapy, which can be targeted as well. And if the cancer is very slow growing and it's within the body of the prostate and chances are it's not going to spread anywhere, which your specialist can advise you on. Active surveillance. In some cases, it's best not to have any active treatment whatsoever, but to see how the cancer develops. And often there are people that live a full lifespan with this very tiny, tiny seed of cancer within the prostate that doesn't go anywhere as well. So there are medicines which block the action of the male hormone, testosterone, and NICE, also the National Institute of Clinical Excellence, has also recommended the use of a medication known as enzalutamide along with hormone therapy as an option to treat hormone-sensitive prostate cancer that has spread. So what enzalutamide does is it blocks receptors for the male hormone, meaning that it blocks the effect of the hormone testosterone on prostate or cancer cells. And my goodness, whilst trying to address those questions, I have come to the end of my show. Mr. Akhtar, I will answer your questions after the show by writing underneath your questions. I hope that's okay with you, but I'm delighted that you have joined us. And likewise, listeners, I'm absolutely delighted that you have joined me on this show on prostate. It's generated a lot of interest. It is very important that we talk about this show and about this issue. Men's health, men's problem. No, men aren't behind anyone in terms of their health. They should come forward and they should talk about it. And hopefully I will see you again next week to talk about another pertinent medical issue with your very own Dr. Shabina Asad Qayyum. But until then, it's Assalamu Alaikum.
Stay tuned to